There's a big story out of Calgary that's making news, a medical clinic that's charging membership fees. Obviously, this is something that's rubbing the Alberta NDP the wrong way. It's a pleasure to welcome their leader, Rachel Notley, back to the show. Every elected MLA right now with the Alberta NDP is sounding the alarm. They're tweeting, they're talking about this story, first broken by the CBC down on Monday after a couple of Calgarians, just regular citizens, I guess, must have called a journalist. I'm assuming that's how that story started. Joel Dryden reporting on it. The Marda Loop Medical Clinic charging about $5,000 for a membership for 2 adults for the year. What especially sticks out at you? What's especially egregious here? Why are you particularly, in my vernacular, pissed off about this?
The concern about this is really basic. In the election, Danielle Smith said, Albertans will not have to pay to see a family doctor. They will not have to reach into their pocket and use their credit card, their debit card, or whatever else in order to see a family doctor. And what we're seeing is the growth of these kinds of clinics, and this clinic in Marda Loop that's just opening up, where what do you have to do to get access to a family doctor? You have to pay quite a considerable fee, members-only medicine, basically. First of all, we're seeing a tremendous proliferation of these clinics now. Secondly, the law on who has the ability to clamp down on these and what tools can be used was finally clarified by the Supreme Court of Canada in April of this year, right before the election. And thirdly, because there is a dramatic shortage now of family doctors, and because the UCP have so aggressively screwed up lab services, especially in Calgary, access to those things is now a different kind of commodity than it was, say, 5 or 10 years ago. And so now it means that for people to get those basic services, they are now looking at having to pay these ridiculous fees to get access.
Could something like this, could a story like this potentially attract physicians from outside the province?
No, that's a ridiculous argument. We've been talking to family doctors all across the board for quite some time. And what they want to be able to do is give good service to their patients. This idea that we would create two-tiered healthcare and that doctors would have to say no to people who needed healthcare because they hadn't paid their $5,000 membership fee. The vast majority of people that I know who are going into medicine these days would suffer moral injury being in that position. The knockoff effect, the cascading effect in terms of the overall deterioration of the quality of healthcare and the quality of health of Albertans would make it even harder to practice medicine here in the province.
Do you think that we've put ourselves in a position with our backs against the wall that we can't examine or discuss or explore a myriad of opportunities to help get the healthcare system out of trouble where we see it, including things like wait lists?
The problem is that we get distracted from the bread and butter work that needs to be done to make sure that Albertans and Canadians get access to the healthcare they need by all these self-interested, constant efforts to find ways to grow the level of private financing in the delivery of our healthcare. Conservative government after conservative government are constantly tweaking to find ways to let people make money off of our healthcare system. And by doing that, they create chaos, they create uncertainty, and they undermine the quality of healthcare. We've just come through a pandemic that has put tremendous pressure on our healthcare system. We know what we need to do. We need to be working on primary care clinics, team medicine for family medicine. We need to bring more family doctors in. We need to deal with the ridiculous barriers between foreign trained health professionals and their ability to practice here in Alberta. We need to properly fund the services that are provided. It's basic, practical, hard work that is constantly ignored in search of these quick fixes and the opportunity for certain groups to make money off the system.
Why is this something that wasn't one of your top priorities between 2015 and 2019?
Because these types of member-only clinics were not operating in the face of this dramatic, scary shortage of doctors and the completely messed up situation with our labs. They could operate and in a way that didn't have the unintended consequence of essentially forcing people to pay to get access to a family doctor. So the environment has changed dramatically. That being said, we had started an investigation into the Cambie Clinic under my government government, but we ran out of time.
Jamie Peterson kind of put orphan wells on you. And he says, well, Rachel Notley, in combination with the Prime Minister, with Trudeau, put in an arbitrary pipeline capacity which landlocked gas in Alberta. This caused several companies to go bankrupt, put thousands of wells and into the fund. So go thank Notley. Kenny fixed it, but the damage was done.
There's a lot that's factually incorrect in there. We, of course, were the government that did all the work to get TMX approved. So the first pipeline to Tidewater in 50 years is something that our government delivered. Secondly, orphan well crisis is something that is built up over 40 years of failing to hold these companies accountable. It's not something that happened overnight. We actually bought rail cars in order to move oil and gas more quickly. And then Kenny actually sold it. And then we ended up with an export capacity problem as a result. We did everything we could to move oil as quickly as we could because we understood that if we didn't do that, that the differential would explode and Albertans would get less value for the resources that we all own. And because we understand that that's a public trust, we were doing everything we could to enhance capacity.